So can you talk a little bit about frozen shoulder, what it is, and kind of the approaches that you're going to take to recover from it?
Yeah, frozen shoulder is interesting on the initial level is that your body has decided in just in microscopic terms that the lining needs to be tighter, if you will. For whatever reason, your body thinks that the fibroblasts that hold all the lining cells start to fire up and create scar tissue, and they start to do this, they start to shrink. And as they shrink, the ability to rotate the shoulder and the ability to move it starts to decrease. And the endpoints become painful. So what happens is you self-reduce your range because the endpoints are painful, and slowly, insidiously over time, which means, so slowly it's like watching a pot boil. You don't really know what's happening until it boils over, right? This pot is boiling very slowly, and as it goes on, you get less and less range of motion. And so sometimes people show up, all of a sudden I got a frozen shoulder. No, really, it's been happening for 4 or 5 months. You've been progressively getting worse. Just today you realized you can't get your shirt on anymore because it's gotten so bad. Interestingly, women notice it quicker than men because women notice when they can't do their bra strap, and men notice when they can't get their wallet out of their back pocket, which is a big difference in internal rotation, right? There's a
Yeah.
lot more internal rotation required to get your bra off than to get into your back
Yeah. I've
pocket.
never taken a bra off, so I can't.
Right. There you go. So anyway, so yeah, having not doing it myself either. So, but I understand it because my patients
Yeah.
tell me immediately that that's the first thing they complain about. Night pain is very common as well, but the ability, functional range starts to decrease.
Yeah.
And so the frozen shoulder usually starts out, sometimes it's a minor injury of some type that inflames the cells, and then the body overreacts, and then it starts to freeze up on you. Now, some frozen shoulders have a natural course. Some people get a frozen shoulder, it gets inflamed, it freezes up, and then slowly over a 1 or 2 year period, it thaws out by itself. But most people can't wait that long, so we try to intervene. If you can get in the early stages, cortisone shot, anti-inflammatory, and stretching programs can slowly stretch it back out and bring it back out. In the really bad recalcitrant cases where people are just so limited, sometimes we end up manipulating them under anesthesia and removing the adhesions and getting them moving that way, and then doing aggressive therapy after that. The other side thing about frozen shoulder, which people underestimate, is that some diabetics are much more prone to getting it. Their fibroblasts don't behave as well. And there are a few patients in my practice where they've presented with a frozen shoulder and turned out had diabetes and didn't know it. So that's always a little caution, a doctor caution, a little red flag. Someone comes in with a frozen shoulder, doesn't seem like they did anything that would have caused it. Um, you should think about the blood sugars a little bit.
Yeah.
But the more common is 40 to 50 to 60-year-old females are more common, and diabetics are more common than non-diabetics.